Welcome to another episode of Dan Frequently Asked Questions. In these episodes, we answer questions of common concern and try to provide guidance in a fairly succinct form. In this particular episode, I'm delighted to say we've been asked a question by a general practitioner, and that pleases me because that means that we have our colleagues that are actually looking at these episodes and being part of the pool of individuals watching what we have to offer on this channel. And the question has to do with hypertensive medication. Keep watching. All right. This general practitioner works in the Maldives. I won't reveal his name, but just to say that he has a patient that is 47 years old, a professional diver, and the last dive that she had done was in January 2020. She smokes and has hypertension and is on a beta blocker called metoprolol, 200 milligrams, as well as amlodipine, 10 milligrams. Now, for those of you that aren't pharmacologists, which I assume is many of you, a beta blocker essentially slows the heart, and a calcium antagonist, which amlodipine is, opens the blood vessels. So essentially you've got a two-pronged approach in which you slow the heart and you open the blood vessels, and under the medication that she's been given, she has a normal blood pressure and pulse and wants to know whether she's fit to dive, especially on the beta blockers. I'm going to answer this in a slightly different way than I usually would by saying that the way in which we consider drugs and diving is by really looking at three elements. We look at the diving, we look at the underlying condition, we look at the medication, and then we make a final decision. So the first issue that we need to address is the underlying condition. If an individual is on two medications, of which one is a beta blocker, which is not a traditional first-line medication, angiotensin receptor blockers actually are nowadays, then I would want to know, why is this individual on a beta blocker? Because there may be reasons that would disqualify this individual that have nothing to do with the beta blocker, but the reason for taking it. So we always ask, what's the underlying condition? The second thing that we would ask would be, what type of diving is this individual going to be doing? The reason for asking that is that with the particular drug that this individual is taking, a beta blocker, it tends to slow the heartbeat and in certain dosages may actually reduce their ability to exercise. So unless this person is really doing the sort of diving that requires almost no exertion, I would not recommend that this individual undertake diving. And then the last question that we do, of course, is the medication itself, which I've partially answered. And that is, the effect of the metoprolol will be to slow the heart, the effect of the amlodipine will be to open blood vessels, and if those two medications in combination cause problems such as slowing the heart rate, which doesn't seem to be the problem, she has a heart rate of 86 beats per minute, what I would still do is I would subject this individual to a stress ECG test, and I would want to know whether the person is able to achieve 4 or 5 stage 4 or 5 on a Bruce protocol, which would represent in excess of 10 METs, which is 10 times metabolic expenditure. And if she's able to do that safely, and the underlying condition isn't the problem, and the type of diving that she plans to undertake is not significant in terms of being strenuous, and it is not unduly deep or in any way extreme, then this individual may very well be eligible to dive. But this is quite a complicated and discretionary case, and I'm delighted that our colleagues are asking these questions and giving us the opportunity to answer them. So thank you for the question, and please keep them coming, and until next time, safe diving.